is slowly but steadily rising in Nigeria, with about 20 states and the FCT now coping with the virus. Now, the challenges of combating the virus at subnational level is our focus tonight on Weekend File. Good evening and welcome to the program. The national response to the fight against coronavirus has been commended by Nigerians and world bodies. And in order to sustain the tempo, Nigerians have continually been advised to adhere strictly to the directives of both federal and state governments aimed at containing the rather perilous coronavirus. As relevant agencies and task forces work assiduously for Nigeria to navigate her way out of the pandemic, we should all be mindful of the state of preparedness of the 36 federating states and the FCT and the challenges they are confronted with in managing this scourge. A look at the statistics indicates that Lagos State has the highest number of 158 cases, followed by Edo 12, Oyo 11, Ogun 7, Kaduna and Bauchi 6 each, Akwa Ibom 5, Katsina 4, Enugu, Ekiti, Kwara, Ondo, and River State, 2 cases each, while Benue, Niger, and Anambra recorded 1 case each. The latest cases were recorded before 9 p.m. tonight. The good news is that patients are beginning to recover from the disease, and we hope to record more successes in that direction. Thanks for joining us as we examine challenges of states in the fight against the rampaging coronavirus. My guest today is the Abubakar Sani Bello, the governor of Niger State. And I am Kurian Umayo, welcoming you to news, views, and analysis. It's a Weekend File, and we'll begin with the news. President Muhammadu Buhari commends Nigerians for their patience. President Muhammadu Buhari commends Nigerians for their patience, resolve, and strong determination to defeat the coronavirus disease outbreak. A statement by Senior Special Assistant to the President on Media and Publicity, Garba Shehu, says the President extolled the courage and sacrifice of those in the front lines of saving lives and appeals to citizens to adhere strictly to all measures put in place. The statement adds that the government has announced multiple measures to assist, including the release of 70,000 tons of grain from the National Strategic Grain Reserves for distribution to the people most in need. Distribution of small cash payments are also being made and will continue to be made by the federal government in the states and local government areas. The Federal Capital Territory has announced the discharge of additional 4 COVID-19 patients from its Gwagwalada Isolation Center. Meanwhile, the Nigeria Center for Disease Control yesterday evening announced 17 new cases of COVID-19. The breakdown indicates 8 cases in Lagos, 3 in Katsina, 2 in the FCT, 1 in Niger, and 1 in Kaduna State, as well as Anambra State. Ondo also recorded 1, bringing the total number of confirmed cases in the country to 305. The United States has become the first country in the world to record more than 2,000 coronavirus deaths in a single day. Here is Joyce Ometo with a global update on COVID-19.
Global coronavirus cases now top 1.7 million, a month after the World Health Organization declared the virus a pandemic. Figures compiled by Johns Hopkins University Saturday 6 p.m. local time indicates that the global death toll is now 106,721, with the number of infections worldwide topping 1,727,439. The World Health Organization said on Saturday that it was looking into reports of some COVID-19 patients testing positive again after initially testing negative. Meanwhile, the United States has become the first country in the world to record more than 2,000 coronavirus deaths in a single day. 2,108 people died in the last 24-hour period, while the country now records more than 500,000 confirmed infections. In Spain, the daily death toll from COVID-19 has continued to slow. The latest figures show 510 people have died, the lowest rise in 18 days. In Africa, the continent reports 12,369 cases of coronavirus. This is according to figures by the African Center for Disease Control and Prevention, collated on Saturday at 6 p.m. local time. In other developments, Brazil has become the first country in the southern hemisphere to surpass 1,000 deaths with coronavirus. Lastly, aid agencies expressed alarm after the first COVID-19 case was confirmed in Yemen, where years of civil war have devastated its health system. That's it from here. Many thanks for staying. I am Joyce Ometu.
The Christian Association of Nigeria, CAN, is pleased with the measures taken so far to curb the transmission of the COVID-19. CAN President Reverend Samson Ayokunle, in a statement, admonished churches to adhere strictly to the rules guiding against the spread of the virus, especially on the occasion of the Easter celebrations. While praying and hoping for the end of COVID-19 soon, the CAN president advised the Christian faithful to use this period of the resurrection of Jesus Christ to pray for healing of the land and in these trying times.
Reverend Samson Ayokunle emphasized the importance of aligning with the government on precautions already laid down for safety of Nigerians and prevention of further spread of coronavirus. CAN president explained that coronavirus pandemic is a global challenge that requires the support and cooperation of all citizens with their governments if the battle against COVID-19 must be won. He is optimistic that if citizens cooperate and comply with the rules guiding against the spread of COVID-19, which have been stipulated by governments at all levels, coronavirus will soon be wiped out from Nigeria. Reverend Ayokunle restated that complying with the rules is not tantamount to lack of faith in divine healing, but to rather do what God has already given the power and wisdom to do. As he said, and I quote, "It is logical that if one sees evil coming, the best thing is to run away from it." End of quote. Churches should therefore adhere to laid down rules, he said. CAN president solicited the cooperation of Christian brothers and sisters in Nigeria while felicitating with them on the Easter celebration. Quoting Psalm 91 verse 3, Reverend Ayokunle prayed God to keep all Nigerians safe in the face of the pandemic.
A new twist was in play as the Federal Capital Territory Ministerial Task Force team shifted gears in ensuring essential economic drivers are not halt while enforcing compliance with lockdown directives of the federal government. Ablahi Suleiman Iyaji tells us more.
It is a race to meet deadlines.
Physical distancing, please, you can buy. Be mindful of social and physical distancing.
For buyers and sellers alike, 2 p.m. is the time they must exit this market to avoid the wrath of the FCT Ministerial Task Force team, whose mandate is to ensure these people adhere strictly to the rules guiding this gathering.
They are enforcers, but they have chosen the path of dialogue. They are begging people to please ensure that they stay in line.
Compliance to directives is the name of the game, as the team would not have any excuse from these worshippers who tried to justify their actions. The chase landed operatives of the task force in Akko Estate along the airport road for more sensitization. Meanwhile, the Federal Capital Territory Administration Emergency Response Team visited some rural communities in Abuja to raise awareness on the deadly COVID-19.
There has been some level of community transmission because most of the cases, we analyze our cases that we have now in FCT. We find out that the people that have it must have transmitted it to other people in the community.
Some people, they don't take it seriously, that they just thought it's something that they're just saying in the sky. But truly, we look at it that really is something real.
This is coming at a time the FCT has discharged 11 patients of the COVID-19 who are fully recovered. Abdullahi Suleiman Yaji, NTA News.
As the federal government rolls out measures to curb the spread of COVID-19, states are also making their individual efforts, as reported by Momso Damian Dati.
From Makudi, Charles Abba reports that close to 50 health workers have been trained in how to prevent and curtail the spread of COVID-19. The training, he said, is at the instance of the Benue State Action Committee on COVID-19.
A social group in the sense that those that work in the hospitals come in contact with their family members, with the public, with patients. And
it is very important to conscientize health workers every now and then.
Meanwhile, security operatives at the border post have been reminded to ensure their own safety first in enforcing directives of both the federal and state governments on measures to contain the spread of coronavirus. Nura Tonko Wakili reports that it was the central message carried by heads of security agencies in Kebbi State during a visit to security formations in border posts in the state.
Basic duty is maintenance of law and order, safety of the men, of the human beings, and that's why we are going there to make sure the place is well secured.
Maintain distance, don't cluster yourself.
And then the way they are comporting themselves, I think it is very is commendable.
And from Sokoto, Delhatu Abdullahi reports that the government has extended stay-home order and interstate route closure by 2 weeks. This, he says, is part of the outcome of stakeholders' meeting on government response on COVID-19 in the state.
There's a need for us to step up our surveillance and monitoring of our borders into the country around the Niger Republic.
So let's pray more and do more by keeping to simple regulations.
From Ebonyi comes a report that the state government has banned the use of motorcycles as means of transportation in the state to ensure compliance with directives on border closure. Kingsley Okoro reports that Governor David Umahi gave a statewide broadcast.
I shall from time to time, and when the need arises, review, alter, amend, or change any of the clauses or issue fresh regulation to deal with the new developments.
Following the total lockdown of Daura in Katsina State, residents have complied with the directives of government. Sani Bashiru reports that major roads and streets in Daura town were deserted.
Nobody may want anything negative in life.
We tell that these people that are selling in the central government to open their shop. Let the people of the town know that all these shops are open.
And now, as Nigeria wages war against the novel coronavirus pandemic, the National Center for Disease Control, NCDC, has concluded arrangements to set up a testing center in Zaria. This is to ensure faster diagnosis and release of sample results.
Everything is in place. It's just to put them all the way they ought to be and get the people ready to start using it. It's really an excellent facility.
Momso Damian Ati, NTA News.
The federal government has assured that it will give food palliative to Ogun State as part of measures to cushion the effect of coronavirus pandemic on residents. The Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadia Farouk, said this during her visit to Ogun State. Lukman Adefeso's report is represented in this package.
Said her visit was solidarity to the government and people of Ogun State on the unfortunate COVID-19 pandemic. She disclosed that the federal government has sent some truckloads of food items to Ogun State as part of intervention program to cushion effects of the pandemic on people. While assuring that the goods would arrive soon, she also hinted that plans are underway to flag off another phase of trader money and market money intervention program in the country.
By Monday, we are going to start the registration of these beneficiaries in all the communities, together with the state government. Over 100 trucks really coming to Ogun State on maize, sorghum and gari. But what I have brought with me now is another food item, rice precisely, that will have been handed over by Nigerian Customs Services. And that is coming in 5 trucks of 3,000 bags of 50 kg rice and 1 truck of vegetable oil.
We're working assiduously with your team as you have rightly helped us intervene. It is my hope and desire that we can fast track this process. If there are any waivers, then you can avail us. That would be appreciated.
The governor advised residents to be patient as the federal government palliative will be distributed to all concerned on arrival.
The fight against coronavirus has continued to gain grounds around the globe. This is as the virus struggles to get out of hand. Kolo Mohammed reports that the Supreme Council of Islamic Affairs was at the suburb of Abuja to distribute palliatives.
Globe buckles under the uncertainties surrounding the strain of the coronavirus pandemic. The Supreme Council for Islamic Affairs prepared at the National Mosque in Abuja its message on hand washing to create preventive awareness and likewise distribute palliatives as support.
In the rural communities, you hardly get this running water. So to encourage them to continue to wash their hands, we have provided this, and we also put soap, Sanitol, which is also a sanitary soap.
The palliatives were then taken towards Mpape, a suburb in Abuja. The people of Mpape came out in their large numbers, frustrating the social distancing stance, and so the distribution was delayed. This is hoping that order will be attained going forward. From Mpape area in Abuja, Kolo Mohammed, NTA News.
Relief has come the way of the people of Ajaokuta local government area of Kogi State as the West African Ceramics joins the federal government and other companies to provide palliatives as part of efforts aimed at cushioning the stay-at-home effects on the people. Charles Alpha has more.
To avert hunger and hardship as fallouts of the stay-at-home directive occasioned by the coronavirus pandemic and subsequent partial or total lockdown by nations and cities, West African Ceramic Limited in Ajaokuta, like other well-spirited Nigerians and companies, is queuing behind the federal government to provide palliatives to communities affected by the stay-at-home directive in Ajaokuta local government area. Various youths and women leaders, community heads and representatives, after washing and sanitizing their hands, put on their face masks, took turns to receive bags of rice, oil and Maggi for onward distribution to waiting families at the various communities.
Since people are inside, they have been suffering because no way for them. But with this one that Ceramic do now, they try very well.
Although they have been doing it, but this today own is more.
The world around is in dire need, and providing cash and food support to the poor and the vulnerable defines West African Ceramics' obligations to the communities where it operates.
People are suffering not because we want them to suffer, but because of the situation all over the world. So what we are doing here is share food relief for our people so that they can have something to eat at home.
In this situation, the whole humanity is under problem. That's why we decided now, among with us, all local governments, we call them, we want to give the support.
Aside food, the company is attending to some of the essential needs of the people, among which are the rehabilitation of Ofunene Road and that of Adogo, which will also be rehabilitated before the rains begin. From Ajaokuta, Kogi State, Charles Alpha, NTA News.
Thank you, Charles. The Nigerian Content Development and Monitoring Board, NCDMB, in collaboration with Petan, has donated 2 ambulances, other relief items to Bayelsa State. Rivers and Delta State Governments, Director of Planning, Research and Statistics of NCDMB, Dr. Patrick Oba, presented the items to the states on behalf of the Executive Secretary Simbiwa Bote in support of efforts aimed at containing the spread of coronavirus. Aya Prezi in Yenagoa tells us more.
Of 2 ambulance buses, 25 hospital beds with drip stands, mattresses, beddings, cartons of sanitizers, and hand-washed plastic buckets, among other relief items by the NCDMB and Petan, are part of efforts to support the state government in sustaining the fight against COVID-19 in Bayelsa State. The Executive Secretary of NCDMB, Simbi Wabote, indicated that the gesture is extended to Delta and River States.
These are trying times for the human race, and everybody has to be careful. And whatever anybody can do to help humanity get out of this problem, so we must do. And that's why you see us doing what we're doing, just to have a human touch, to be able to give hope to humanity, at least in this locality.
We are happy as a people. In fact, I will use this medium to call on every other organization that has anything to do with the good people of Bayelsa State.
The consignment for River State was presented by the General Manager, Zonal Coordination of NCDMB, Dr. Gina Ogina, and was received by the State Commissioner for Health, Professor Prince Will Chike.
We are very happy to be of assistance to River State government.
So we are very grateful and we thank you for your efforts. Convey to us the serious appreciation from His Excellency, the Executive Governor of River State.
The NCDMB, under the leadership of Simbi Wabote, has been responsive to emergencies by supporting government efforts in various ways. In Yenagoa, Aya, Prezi, NT News.
While the Nigerian Shippers Council is stretching its tentacles to ensure that the ports remain safe of coronavirus, it is also collaborating with security agencies to enhance effective operations during the lockdown. The Executive Secretary of the agency at a meeting in Lagos said the period is crucial to clearance of outstanding cargoes and decongesting the port for accelerated economic gains. Michael Olaleye reports.
Despite the total lockdown in Lagos, the Nigerian Shippers Council has been leading the vanguard of ensuring that port operations are seamless without triggering any COVID-19 risk factors. At one of the agency's interaction with terminal operators, the general manager of 5 Stars Logistics Terminal decried the activities of some security operatives, which it said frequently deny personnel access to the ports despite proper identification.
As long as they have the ID from the company and a confirmation that they are essential to work, then they have to come.
Finding a solution to this challenge informed this meeting with the Navy, where the Executive Secretary seeks for more synergy as ports operations are crucial to the delivery of foods and medical equipment during this period.
In the maritime sector, we will also contribute to make that sector open to help the economy, but also to keep at bay the rate of infestation.
While suggesting the use of a collective identification tag, the Navy hinted about its surveillance measures at sea in order to keep coronavirus at bay.
We alerted relevant agencies, the Port Health, NPA, of vessels that have made calls at ports in cities where regarded as high risk.
Provision of free buses to clearing agents and port workers, as well as strict adherence to regulatory health guidelines, are some of the measures the Shippers Council has instituted at the ports. In Lagos, Michael Olale, NT News.
The Chief of Army Staff, Lieutenant General Tukur Buratai, directs troops of Operation Lafia Dole to brace for the final elimination of the remnants of Boko Haram insurgents still hibernating in parts of northeastern Nigeria. Lieutenant General Buratai gave the directive while on an operational visit to the Northeast Zone. And I will bring you Ismail Musa, our defense correspondent.
The Chief of Army Staff, Lieutenant General Tukur Buratai, in company of some senior officers, were at the Menglari Forest, southwest Tasumu, Ngadua, in Mafa local government area, Borno State. Their mission is to rake and comb this difficult terrain, an area used by Boko Haram insurgents as their major route to parts of Maiduguri. The visit also provides an avenue to scale up operations for the final onslaught against the terrorists. At the Army Super Camp Mole and the Special Forces Super Camp 12 Chabol, the Army Chief, who has temporarily relocated to the northeast, charged troops to take advantage of the newly acquired equipment and platforms to hasten the elimination of the remnants of Boko Haram insurgents in parts of the region.
Able to stop most of the suicide bombings, able to stop some of the oppression, attacks, the outskirts. It's time for you to now go beyond that. Is that clear? Yes, sir.
While at the Alo Dam, outskirts of Maiduguri, the entourage embarked on reconnaissance. These are some of the recently acquired combat vehicles set for injection into the ongoing counter-insurgency operation. This is to upscale the firepower capacity of the troops preparatory to the final onslaught against the insurgents. From Maiduguri, Borno State, Ismail Musa, NTA News.
Thank you, Ismail. Still on defense, the Nigerian Army says there are no Chadian troops on the Nigerian side of the Lake Chad. The acting director, Nigerian Army Public Relations, Colonel Sagil Musa, at a news conference in Nigerian Army Super Camp Gamdu in Borno State, gave the clarification following news making the rounds insinuating that the Chadian Defense Forces are deeply stationed in the island of Nigeria. Colonel Sagil added that the ongoing multinational joint task force operation is an agreement among the Lake Chad Commission member countries.
Chadian or any other foreign countries' troops on Nigerian side of the Lake Chad or in any other part of the Nigerian territory.
Now, the acting director stressed that the Regent Chadian Operation Boma Wrath covered only Chadian territory.
Is with the knowledge and support of Nigeria in honoring and furtherance of the existing multilateral cooperation between the Lake Chad Basin Commission countries under the multinational joint task force.
All right, this is Weekend File on NTA Network Service. Next are reports by our correspondents on the preparedness, or if you like, efforts and challenges of the states in Nigeria in managing coronavirus pandemic. We'll be back very shortly. And my guest tonight, of course, is Abubakar Sani Bello. He is the executive governor of Niger State. Do stay with us.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
Yeah! Stay Home Data Plan. All existing Glow customers now enjoy up to 20% more data. Glow Unlimited.
Main way coronavirus spread is when infected people sneeze and cough. Small droplets of fluid expelled by cough or sneezes are laced with viruses looking for new respiratory tracts to infect. When a sick person sneezes around someone who is healthy, the virus can land in the nose, mouth, or even the eyes, causing an infection. Symptoms can include fever, cough, shortness of breath. Symptoms may appear within 2 to 14 days. Seek medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
As the world combats the novel coronavirus, also known as COVID-19, the Nigerian government is committing funds and donations are coming from the private sector to tackle the virus. The emergency response to COVID-19 should not be abused as an opportunity for corruption. Do not embezzle the funds. Do not extort money from patients. Observe due procurement processes. And all citizens must guard against the peddling of false information. Do the right thing. Integrity pays. This message is brought to you by ICPC and NTA.
Now believe this Koroti. You know if you touch black man, if you like, gather the whole Niger, come together, make the cough. Nothing.
Which one you want?
Give me V&D.
I beg, get small pieces.
How much you want to give him?
Give me 200. Take your change now.
You don't want your change.
My people, this coronavirus, na serious matter. May una wash una hands regularly. Come use alcohol-based hand sanitizer. If you no see water, wash your hand. Make una sit down for house. You see this virus, so e no get leg. Now we dey waka kurukere. No waka around, make the virus for die. No forget, say the betterment of people now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Public service announcement. The general public, especially parents and caregivers, are hereby informed that all primary health care centers, PHCs, remain open throughout the country, including states with a lockdown order. The outbreak of the COVID-19 in the country should not affect the routine services provided by the PHCs. Governments at the national, state, and local levels have put in place measures for safe delivery of all primary health care services at PHC centers. I therefore urge parents and caregivers to continue, as usual, to take their children to the PHCs closest to them for immunization, growth monitoring, antenatal care, childbirth, and other PHC-related service delivery. All caregivers, health workers, and Nigerians are advised to obey all government guidelines on social distancing, frequent hand washing, self-isolation, etc. throughout the period of the COVID-19 outbreak. Dr. Faisal Shoaib, Executive Director, CEO, National Primary Healthcare Development Agency, announcer.
You're welcome back. Now let's begin by giving you an update on coronavirus in Nigeria. 13 new confirmed cases have been recorded in Nigeria, bringing the number to 318. 70 cases have been discharged, while 10 deaths have been recorded. NCDC says of the 13 new cases, 11 are in Lagos and 1 each in Delta and Kano states. Niger State to declare total lockdown of the state from Monday, April 13. There will be a break for people to stock up on Thursday 16th, Monday 20th, and Thursday 23rd of April 2020.
Government last week relaxed the restriction movement imposed on the state to between 2 p.m. and 10 p.m. daily to ease the effect on the populace. Governor Abubakar Sani Bello says the privilege was abused by the people.
A complete lockdown of the state for 24 hours for 2 weeks, starting from Monday the 13th of April 2020. That decision has become extremely necessary in view of the recent outbreak.
Abubakar Sani Bello says as a responsible government, 3 days window period will be allowed on Thursday 16th, Monday 20th, and Thursday 23rd of April 2020. The governor disclosed that Limawa community is to be in complete isolation for the period of 2 weeks, even as government is making efforts to track down those that may have had contact with the man that tested positive of COVID-19.
There will be a dedicated court, magistrate court for compliance. Anyone caught, whoever that person is, will be sent to that court.
The governor commended corporate bodies and other individuals that are complementing the efforts of government through donations, all geared towards fighting the spread of COVID-19 in the state. In Mina, Suleiman Kodogi, NTA News.
All right, and let's welcome our guest tonight, who is the Governor of Niger State, Abubakar Sani Bello. Your Excellency, good evening and welcome to Weekend File. Yes, Your Excellency, Niger State has just recorded its index case, and of course you have taken some relevant actions. I want you to expatiate on the action that you have taken on hearing that your state has recorded its index case.
Unfortunately, we have recorded an index case, and at this point, I find it extremely necessary that we have to order a complete lockdown of the entire state. We have to restrict movement in between local governments and also entry into the state at our various borders. It is unfortunate that it has happened. Luckily, and I hope it remains this way, the said gentleman came back from a trip, I think, to Lagos. On reaching home, his family denied him access into his own house, so they called our health officials to come pick him up. He's been in the isolation center since that day, so hopefully it will be contained. We will continue to keep an eye on the situation. We will continue to monitor the activity, especially around the Limawa area where he resides. And hopefully, after 2 weeks of complete lockdown, if there are more cases, we should be able to have some symptoms. So I hope, by the grace of God, with the necessary measures we put in place, closing our borders, putting our health officials on the alert, hopefully, will mitigate against some of the new cases to come.
Now, it's interesting you gave us the background leading to the index case. Now, his family denied him entrance into his own home, which is good. And what are you doing with respect to the contact tracing? He came from Lagos to Niger State. He must have, of course, used one transport system or the other.
Yes, at the moment, we put in a tracking operation to identify those that might have been in contact with him over the period of time, and also send them to isolation centers. Like I said, the information right now is very vague, but I think the health officials are doing their very best to ensure that they track all contacts within the next couple of hours or days.
Okay, let's talk about the lockdown, which is going to commence on Monday in Niger State. You also mentioned that you're going to allow people to stock up on the 16th, 20th, and 23rd of April. How is that going to work if you want a total lockdown?
Well, at the moment, we
we have a restriction, movement restriction that has been in place for almost 2 weeks now, and we gave a window to allow people to be able to buy medical supplies, foodstuff. Unfortunately, it was abused. And at the same time, we know as a government, we try our best to provide palliatives in terms of foodstuff to all the wards in Niger State. But I don't think we're able to reach out to each and every house at the moment. So to reduce hardship of our citizens, we felt we should give a grace period. Now the window is not for you to go and socialize, and that is the mistake people are making. The window is for you to go responsibly, get your foodstuff or supplies or whatever it's necessary to keep your stay at home more comfortable, and go back home. It is not for you to go and socialize or go for religious gatherings or whatever you want to call it. So that whole system has been, it was abused. I hope this time around we'll monitor very well what is going on. I hope we'll make sure that they observe social distancing. I hope no markets will be open, definitely. But I hope our security agents and the COVID-19 Task Force Committee, both at the state and the local government levels, will ensure that they monitor activities within their respective domains so that we don't have congested stores or supermarkets. I think it has become absolutely necessary to allow a window for people, because most of our indigenes here have to go out on a daily basis to provide for what they will feed. I know we can never allow that to happen, but I found it necessary that we should provide a day or two in a week so that they can go and restock their stores. But like I said, it is not an avenue for social gathering or religious gathering or whatever you want to call it. It is an avenue for you to go on only when it becomes necessary for you to go and get some foodstuff. I don't see how we can deny completely people from going out to get either medication or foodstuff to take care of themselves.
All right, thank you, Your Excellency. We're going to take a short break now. When we come back, we will conclude the conversation. There are some other issues I would like you to address, concerning the lockdown and how you are, planning to manage COVID-19 in Niger State. We'll take a short break now. We'll be back momentarily.
So, you now want to pick my call?
Then bomb me where? Mommy of life. Toilet, mommy.
Where my car?
Mommy, now smart things remain.
If my car not ready before Kokoro tomorrow, me and you go put leg inside one trouser. One lie.
That was my phone. Yes, ma. Yes, ma. Yes, ma.
Look at this phone.
All right. Yes, ma. Hey,
Majekini.
Mommy, no be you. Don't waste your credit. When I finish, I go call.
You call me. Me where my middle name na credit. Where Glow they give me boku.
Glow and Mebo get 5 times your recharge to call all networks. Recharge with *555* PIN hash.
This talk people. I beg, give me a phone, make I go, Joe.
Talon sa taku yen.
Nigerians, coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide, don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long, live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possibility.
The coronavirus, also known as COVID-19, is spreading at an alarming rate all over the globe, including Nigeria. With the number of infected persons in Nigeria increasing daily, prevention is better than cure. Coronavirus has no cure. The virus spreads from one person, who affects two persons, and by the time the affected person is isolated, the two persons have affected four, and it keeps spreading. You must take preventive measures to save yourself and that of the people around you. Always wash your hands with soap and water. Put distance between yourself and others. Whenever you cough or sneeze, cover your mouth. Clean and disinfect surfaces. Stay at home if you're sick and contact the proper authorities. Together, we can cut down the spread of the coronavirus. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest TV network.
Action. Make your home the place to be with GoTV's super cool kids channels. That sounds fun. From funky friends that'll keep even the little ones busy. All right, everybody, let's do this! To learn as you watch educational shows for curious young minds. You can do some amazing things. There's plenty for everyone. Tune in to our kids shows and get everything you need to keep the kids entertained and learning the fun way. GoTV. Live it, love it.
Alright, you're still watching Weekend File on NTA Network Service. We are still talking with the Executive Governor of Niger State, who has been our guest, Abubakar Sani Bello. Sir, we are back to you, sir. Do you have any special monitoring mechanism that you have put in place to ensure the adherence to the lockdown in some population, high density areas, like Suleja, which is part of Niger State, and perhaps other cities in Niger State where, people live, in clusters?
We have task force in each local government. We call it a COVID-19 committee or task force. And I think all the agencies are involved in that task force. Most of our senior political office holders are also part of the team, and including the local government officials. So I think we have quite a large number of representation in those task force. I hope sometimes people at that level become, they still don't believe the seriousness of this COVID-19. And I hope at that level we have been seeking for cooperation with the communities, through the traditional rulers, through the religious leaders, so that we get all the necessary support and cooperation from the community. At the end of the day, we're doing this for their good, and we have no intention to inconvenience anyone. Whatever we're doing is absolutely necessary, and we have to do it at this moment so that we save lives.
Now, Your Excellency, do you have any plans for palliative measures? Because, of course, when you lock down, many people will not have the opportunity of course, fending for themselves, especially those on daily pay. Is there anything like palliative in your arrangement?
Yes, at the moment, we have already started distributing grains at ward level, not local government, at ward levels. And my appeal to the community is for people not to look at this as a government largesse. Sometimes the problem is even those that do not need these food items coming from government will insist they will get. As a matter of fact, if you have more and you can share or you can spare to your neighbor that doesn't have, I think that would be encouraged. So we have started distribution of food items to various wards, and I just gave direction this evening that it should continue. So hopefully by next week we'll see how we can purchase more food items to at least keep us going for the next 2 weeks.
All right, Your Excellency, what is your assessment of the combat of coronavirus in Nigeria, both at the national and subnational level? Of course, Nigeria has received a commendation from world bodies in the way and manner the COVID-19 is being managed in the country. Well, let's get your own assessment. Of course, going forward, what should we look forward to doing, to ensure, because this virus, of course, is rising by the day?
Well, I think initially it was a bit slow, probably because at that point, like someone said, a lot of people thought a lot of factors would insulate us from this virus. For example, there were rumors that because of heat it won't work over here, because you're black, it won't affect you and what have you. But with the recent cases, it has shown that no one is being spared. So I think the approach has changed. All hands are on deck in all states. I can see a lot of seriousness in the states. Even here in Niger State, the awareness has improved. I mean, for a family to deny the breadwinner access into his own house, I think that is a good sign. And last week, again, I know we had a truck that came from somewhere down south for one of the market days. All the villages, all the communities refused to allow the passengers on the truck to get off the truck until we sent our officials to go and get them and send them to isolation center. So I am encouraged by what I have seen so far. I think we can do more. The major challenge for me, I think, we need to have more test centers. For example, on record, we're saying we have only one case, but it doesn't mean we have only one case. I go for it, but I strongly believe we may be looking at more cases, but you can only confirm if you carry out tests. So test centers are really important in this war. At the moment, we should be testing randomly. For example, in the case of Niger State, at the moment we should be testing virtually almost everyone in Limawa, for example. So, like I said, I'm highly encouraged and motivated by what I have seen so far. All the states have taken this matter seriously. The awareness has increased. I think the response by the community in support of social distancing has improved. We still have some challenges in Niger though. Sometimes you find people violating the no movement order, and that we intend to work on, especially without outbreak of one case now in Niger State. So we have to encourage people to stay at home and to go out only when absolutely necessary.
All right, Your Excellency, Governor Abubakar Sani Bello of Niger State would like to thank you for your time and your insight. It's been wonderful hosting you this evening on our program Weekend File. All right, you're still watching Weekend File on the NTA Network Service. Now we take another break.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
And aggressive disease containment.
Now on lockdown.
One of the measures the country.
That's the question.
News that connects you globally.